I like people when they're aware of themselves, like they have Googled and they have come to, when you Google, one of the option which comes is cancer for every disease. If I could make a bold statement, people know more about their car than their body. It's also one of the causes for increased memory loss in elderly. They think they are becoming old and they're forgetting. But it could be that they have a bradycardia, which is not treated.
Welcome to Health Charcha Season 2 with Medtronic, a podcast where we simplify complex medical conditions, share expert insights, and spotlight innovations that are redefining patient care in India. I'm your host Kartik, and today we continue our conversation on bradycardia, a condition that often goes unnoticed until it begins to significantly impact everyday life. Joining us today is Dr. Ranjan Shetty, who is the lead consultant cardiologist and medical director at Sparsh Group of Hospitals, Bengaluru. With over 20 years of clinical experience, Dr. Shetty is widely recognized for his expertise in advanced cardiac interventions and is among the most experienced leadless pacemaker implanters in the region. First of all, doctor, thank you so much for sparing your valuable time.
Yes.
I'm sure that the conversation that we are going to have with you is going to be really insightful for all the listeners and the viewers who are going to watch us and who are going to stream us on all audio platforms. So thank you so much.
Yes. Thank you, Kartik. Happy to be here. Yeah.
Well, doctor, before we start this podcast, let's get back to the basics. And of
Yes.
course, the need of the hour is to decode the basics. We are talking about bradycardia, one of the conditions that often goes unnoticed. And before we start and before we go into the depth of this issue, what is bradycardia and what are the signs and symptoms that people should watch out for and they shouldn't neglect at all?
Yes. So, Kartik, bradycardia is a lower heart rate. Now, there is a paradox here. Healthy people, when they have lower heart rate, they do well. The best heart rate for people to have is between 50 to 60.
Okay.
And, Olympic athletes and, at peak, those Olympic, their heart rate can be 31, 32, 33. And their combined heart rate of 2-3 people will be less than our heart rate.
Of course.
So having a lower heart rate itself is not a disease.
Okay.
If at all, it's a sign of health. So, nowadays people have wearables and they're always with a lot of devices. And sometimes the problem is in the device, not in them, because they see 35, 40, they come running to us. So people with a lower heart rate, with ability to increase the heart rate when they walk, and if they have no fatigue, no symptom, no unconsciousness, no dizziness, it's okay.
Okay.
So no low number is really low. But having said that, we do want people to have a heart rate less than 44 at awake state, maybe less than 35 at sleeping state. Now, as a disease, when bradycardia presents, that's when people have lower heart rate,
Okay.
but they can't raise it when they want to raise it. So this occurs generally in elderly and there is associated fatigue. They also feel sudden dizziness. They want to do something. They're tired, they can't do, and suddenly they could have a feeling of a blackout kind of feeling, that andhera wala sinking feeling is what they could have, and some of them could actually faint. So these are the bradycardia which are worrisome. So we have to, the paradox as we discussed is that we have younger people with the watches coming and telling us we have a lower heart rate. What do we do? Whereas the real older ones who need some therapy neglected, thinking that it's okay to have a lower heart rate. So not just the number, look at the whole picture.
And doctor, we live in a country like India where, people are quite hesitant to go to the doctor.
Yes.
And of course, everyone has their homegrown remedies.
Yes.
Everything goes back to their grandmothers, to their elders, every time when they feel uneasiness. And of course, with the advent of technology, everything being available on a 7-inch or a 14-inch screen, people have a habit of going to the Google Baba. And of course, they write down the prompt, they get the answer. But of course, it's a search engine. Not everything that is being displayed on a search engine is absolutely correct. This is why there are experts and there are doctors. What do you think? How prevalent is bradycardia today in India?
Okay. So, as we discussed, the pathological bradycardia or a harmful bradycardia is quite common. So, at age of 60, I think 1% of population could have it. Which is a huge number for a country like ours with 140 crore. 1% also makes it a big number. It's also in crores. Then at age of 80, up to 5 to 8% people could have a low heart rate, unexplained low heart rate, which could endanger them. Younger age, it's less common, maybe 0.1%. It can occur at any age, but typically so-called sclerodegenerative wear and tear problem is more common in elderly, and they need it. Again, just to repeat, go by your symptom. You could do something earlier, you're not able to do now. Don't attribute it to age. Find out, is there a problem in your body which is causing this problem, because there are solutions now. It's very important not to neglect your symptom. I like people when they're aware of themselves, like they have Googled and they've come. But as you rightly put it out, when you Google, one of the options which comes is cancer for every disease you have. So it's important to be smart, but it is important to be self-aware.
And placebo plays a very crucial role in this, because every time an individual goes on a search engine and they try to Google things, of course there are things that come into existence. There are psychological conditions that come into existence, and of course with that their mindset gets shattered. Like you rightfully said, every symptom comes with cancer on a search engine. Being into this profession since last 20 years, I mean, it's been more than 2 decades for you. I'm sure that you have seen some cases that went underdiagnosed or they were detected late. What usually happens when bradycardia cases go underdiagnosed or they are detected late in many patients?
So this is a very good question, Kartik. So basically, when we talk about bradycardia, people think heart is one disease, only blockage. But it's not so. Here we are talking about the electricity of the heart. Heart, which is fine, but there is a problem with electricity. When it is bradycardia, what we tell people is, now your current is suddenly it's off for some time. For a TV, you put you want to protect your TV and phone with with stabilizers.
Correct.
But when it comes to the most important engine, it's important to look out. So it's truly an electrical problem of the heart with normal mechanical. The way I explain to my patient is, look at the fan. Fan is fine, but the electricity wire is loose now. That's the typical bradycardia. What do you do when there is a loose wire? You need to take care of that. You need to sometimes replace the wire, sometimes produce the alternate source of electricity, because the machine is fine, heart is fine.
Absolutely.
So it's important to be aware. When people miss it and when people don't take it seriously, suddenly the electricity of the heart stops and the person could collapse. He or she is not able to maintain their balance. That fall, it could be dangerous. It could come without a sign and symptom. We have had people, most of the time, especially in India, we pick up when people come with a fracture. So they have fallen, they've broken the bone. Now you need to fix the bone and also fix the heart. Or they, some of them have drowned because they're swimming and they don't know that their electricity could, because it's such a vital organ that lack of electricity for a minute is too much for the body to take. It's like, if your Wi-Fi is routing, you could wait till that or circle disappear. Here there is no waiting. So it's important to be aware of your own numbers. You should know what's your heart rate normally, what is it likely to go up when you exercise, and if you know that, when the wires are wearing off. People, if I could make a bold statement, people know more about their car than their body.
Absolutely.
A small change in the sound of the car, they're aware. There's something, I need to take it for service. But when it comes to their body, they neglect it more.
And like you rightfully said, people know more about the commodities that they own rather than the heart that they have. And of course, this is one of the most important engine that is running their entire body.
Yes.
But doctor, don't you think that as soon as bradycardia progresses, of course, when it's left untreated, there are a lot of signs and symptoms that also occur. Like you rightfully said, a patient might come to you with a fracture.
Yes.
Because they ignored the signs and symptoms of bradycardia and now they have fallen. So because of that, they have a fracture. But when it's left untreated, a terminology, a technology, you might say, comes into place. That is a pacemaker. Is pacemaker really necessary if bradycardia progresses and if it's left untreated?
I can't agree more. Yes, it's like an inverter. Your electricity has a problem, you need a backup.
Correct.
These pacemakers are true backups. They keep looking at your heart. They can monitor. If you have your own rhythm, nothing happens. It works. If you don't have the rhythm, they search for the rhythm. If not, they give a rhythm. So they're truly like an inverter which is needed. There are indication. Again, it's not one disease. Bradycardia is at least 100 disease. As jokingly I say, to become a cardiologist, you need to study 11 and a half years from your 12th. That too, uninterrupted. So if it is one disease, you don't need 11 and a half years. You could do it shorter. So there are obviously more than one disease. There are more than one opinion, but it's important to be aware. Just because you have bradycardia, it's not necessary you need a pacemaker. There are many, many ways we can manage. But since it is a mechanical problem, it responding to just medicine, chances are lesser. It's more likely you need a backup like a pacemaker, but not all cases.
And doctor, with pacemaker, I'm sure there are certain limitations that a patient or an individual might go through, because these are wired pacemakers that we are talking about. And of course, with the advent of technology, medical science has progressed so much that now there are leadless pacemakers as well. But if we talk about those conventional, traditional wired pacemakers, do they have certain limitations for a patient? Because of course, there are newer methods as well. Because with science getting advanced every single day, these pacemakers are still in place. They are still being used. Do you think there are limitations?
Yes. I think they have a huge place. That's what we should understand. So traditional pacemaker has a battery, because that's this one. It has wires, and that wires have to go through a vein. So typical places it is positioned under the skin, and then you go through the vein and you reach heart. So there are multiple steps here, and there are multiple places where the things could go wrong. In medicine, the rule is very simple. Keep it as simple as possible. More complication it is, more problems. The problem now could come at the battery level, at the wound level, at the puncture level. When you're puncturing, it could go to lung. Having said that, all the complication put together is only 2 to 3%. In expert hand, it works very well. So this is not an argument against pacemaker. It's an argument for pacemaker. But if you could put the same pacemaker with much less complication and much quicker, obviously there is the option sounds better. So the first question is, does the patient need a pacemaker? Once they need pacemaker, the next question is which pacemaker and what would be the relative advantage. The minimum, once we decide, is they need a traditional pacemaker. The better one for some cases is what we call as a leadless pacemaker, because leadless pacemaker, all these three things, the lead and it's the connection and the battery, is now just one thing. And like angioplasty, it's just taken inside and injected. So that makes the procedure very simple. And with advancing technology, now the battery life of this has been amazing. So they last 15 years easily, most of these pacemaker. And the thresholds, because they're very close to heart, the thresholds are much lower. So the battery wastage, which it's a typical physics thing which occurs, is minimal. And this pacemaker may be switched on and switched off, and patient goes home next day. No long-term antibiotic, no wound care, taking bath, wound care, food, lot of things people go through. So all those doesn't exist with the minimally invasive pacemaker. But just to summarize, if you need a pacemaker, you need a pacemaker. Just the fear of other pacemaker shouldn't stop people from getting a pacemaker, because there is absolutely no alternative. The worst thing you could do is not, when you need it, don't take it and fall down, break your bone, treat the bones. It's all painful. It's all dangerous. And also the other thing which occurs, if you don't put a pacemaker when needed, is the brain suffers. You may not fall all the time, but you might feel like a dizz. And this dizz, the brain is suffering. It's also one of the causes for increased memory loss in elderly. They think they're becoming old and they're forgetting. But it could be that they have a bradycardia, which is not treated. The brain is getting a shock with each, some beats, and it's losing memory. And this memory loss does not come back.
Dr. Shetty, you have been a pioneer when it comes to leadless pacemakers, especially in this particular region where we are here right now. Leadless pacemaker, like I said, is is one of those terminologies that are being thrown around like visiting cards on the crossroad. And of course, this is the technology that a lot of cardiologists are also opting for. And medical science booming every single day is giving us the right path of telling that there are experts. You should often go out. You should get yourself checked. Leadless pacemaker. When we talk about leadless pacemaker, uh, how do you think leadless pacemaker work? Firstly, because for all the layman people who are watching us and who are listening to us, they don't really know what are those nitty-gritties of how a leadless pacemaker works. So if you can shed some light on that.
I think this is a very important question. So the pacemaker, which I already explained about a device and a lead and a connector, now is miniatured into a very small structure. It's just this much, and it's directly injected into right ventricle. You know, injected in the sense it's not just left. You go there, you fix it there, and you leave it there. It doesn't move with the heart movement after that, and it works very well. So this is one of the leap in technology which occurred in the pacemaker space or bradycardia space. So once this is available, initially it was meant for people who couldn't take the other pacemaker. It was meant for people with a problem here, thoracic problem, infection. But now it's almost a primary treatment option for most people who opt for it. Procedure is very simple because you're just going and fixing it and coming out. And with each generation now, the battery life has become longer. Although it's a single, most pacemakers now are a single chamber pacemaker. They have a mechanism of sensing the other chamber and coordinating the beat with the other chamber. Pacemakers, by the way, are very, very intelligent devices. If you look at, for example, a heart stent is very simple. It's just a plumbing. You go, you just open and you put. It does the job of plumbing. There's no intelligence in the stent itself. Whereas a pacemaker is a very intelligent device. It has multiple roles. It has to look for natural beat, look for natural rhythm, allow it to happen. And when that doesn't happen, wait little longer because heartbeat varies, beat to beat. And then when it's not there, just then give a beat so that you don't fall now. So it's a very intelligent, sometimes we believe there is a computer inside a pacemaker. It's quite an advanced, intelligent device.
And doctor, will it be true for us to say this, that leadless pacemaker are really patient friendly, and especially for those who are going through severe bradycardia?
I can't agree more. They're very, very patient friendly because, these patients, it's even possible that I do the procedure in the morning and discharge them in the evening. It could be just a daycare procedure, whereas the other one, there's always a wound and, the infection to be managed. We are good at managing all this. It's not a point against a pacemaker. I keep telling it and I want to emphasize, whenever a new technology comes, we demonize the old one. It's not true. It's not like we should say that's needed, but this is better in some ways. So there are roles for both, and but obviously the newer one. It's like the new smartphones versus the
older
old
ones.
Phones.
Yeah.
Talking even that was doing a wonderful job or a better job.
Yes.
But we want more now.
We're greedy people, right? We're a bit selfish. Every time when we get something which is more technologically advanced, we want to grab it.
Yeah.
But before we wrap up this podcast, Doctor, I'm sure that being in this profession for so long, you have been a pioneer in this industry. And of course, leadless pacemaker is your thing. You are the master of it. And I'm sure a lot of patients have walked into you. They have shared their sufferings with you as well. Can you share one of those real-time patient's journey where leadless pacemaker actually made a difference in that patient's life, be it their recovery, be it their comfort, be it the quality of life that they were living, even after going through such big heart issues?
Yes, so I've been using it for a long time. We have a lot of patients in our follow-up. Each patient journey is different, but it's been amazing. So I've had people who required a TAVI, which is a transcatheter aortic valve, also had a conduction block. And moment we put, the TAVI, which is where you change the valve percutaneously, again, amazing technology, did a great effect on the patient. But you put this minimally invasive pacemaker, they are now running and they're doing their activity. I also have I should say it was a little funny case in the sense that this patient, who was an elderly gentleman, actually came for his leg pain. And all he wanted to get is his leg surgery done. But when we looked at his heart had two issues. The rhythm was off and also had a valve which was off. So I ended up doing a TAVI and then putting this minimally invasive pacemaker. And now this is a recent case. Now it's been 6 months. The patient leg pain also has disappeared and is not ready to come for the leg surgery because he feels perfectly fine. And these are some of the cases. What we keep telling people is heart is like an engine. It's very, very important. You rectify it, sometimes paradoxically, a lot of other problems just disappear because you're now able to supply more blood to each organ and you're able to heal the organs better. So sometimes, it's very important to take care of your heart in many, many ways. Electrical problem of the heart is real. And the other point which we are still not fully able to understand in Eastern India, which is like West Bengal, Orissa, and even part of Bihar and Assam, the chance of an elderly getting pacemaker is 10 times higher than South. Now, people have blamed it on mustard oil because that's common. But I'm not too sure whether it is mustard oil or anything. But yes, the chance of having more electrical problem is more in Eastern India. So there, the numbers of pacemaker requirement is sky high. It's high.
Okay.
So look out. There is obviously a lot of genetic differences in each places. But anybody at any point could be in one of these medical conditions, which could be easily managed with current technology.
And Dr. Shetty, of course, we are really stubborn people. We don't really go to an expert. We don't really go to a doctor till the time things don't get really serious. A small message for all the listeners and the viewers that you want to share with, telling them why is it important for them to go see a doctor, see an expert, consult them, because things that they read on the internet, things that they get to know from their friends, family, is not really helping them out in any certain way. Of course, an expert is somebody who has mastered this art, who can help you live a better life. So one small message if you can share with all our listeners and viewers.
That's very nice, Kartik. I mean, just to go back, as I told, people are very careful with their material things. Nobody wants to repair their car on their own, reading Google or whatever. They will still take it to the right person and make sure even the back seat cover of the car is in perfect position. But the most beautiful thing and maybe the biggest engineering marvel of all time is human body or animal body, because we can't still predict how to make a body like this on our own. We are not there yet. So it's very important to listen to yourself, understand what is wrong. As a patient, you have right. It's not that I'm not even I'm not insulting people's intelligence. They have right to know about themselves. They have right to read, but also like the most valued possession. There's no better valued position than your body. It's important you go to the right doctor, as you said. Have a frank discussion. Absolutely. I keep telling my patients, when it comes to some of the complex procedure, I'm not offering it to you because I can do it. I'm offering it to you because you need it. So it's very, very important. There are a lot of procedure. A lot of us are experts. But question is, do you need it? And it's okay to ask questions. It's okay to understand. But please go to the right people, ask the right question, get all the answers, and then get the treatment. Don't get carried away with, as you rightly said, with somebody, seeing one case of a relative is not medical experience. Talking to people is not counseling. So these are all scientific things which we need to follow. All of these are science. People have put their effort. But please be open. Asking question is definitely not wrong. You're not insulting either of the people. But take a very informed decision. And the worst we see is in diet. Everybody is a diet expert. It's so difficult to convince people. At least these medical thing, they will still respect you have done something.
Yes.
But when it comes to diet, they want you to tell what they think is right.
But thank you so much,
Yes.
Doctor, for sharing your valuable insights. I'm sure the things that you shed light upon, the insights that you really portrayed during this podcast is going to be really helpful for all the listeners and for all the viewers. I had a great time with you. Thank you so much.
Thank you, Kartik. Thank you.
Well, bradycardia is more than just a slow heartbeat. It's a condition that can affect quality of life if not addressed in time. It's time you decode your rhythm with advancements like leadless pacemaker therapy, heart rhythm management in India entering a new era, one that is minimally invasive, reduces complication, and allows patient to live with greater confidence and comfort. When heart technology becomes invisible, patients can focus on living fully. That's all for today's episode of Health Charcha Season 2 with issued in public interest by Medtronic. I'm your host Kartik signing off. Until next time, stay informed, stay proactive, and take care of your heart.